Are you over 60? Tired of dealing with stomach pain, joint aches, constipation, or persistent insomnia? Just one glass of properly mixed baking soda water a day can help improve 12 common health problems in seniors, naturally, safely, and effortlessly. And today, I'll show you the scientifically correct way to use baking soda, something most people overlook. But when done right, the results can be surprisingly powerful. Direct Hit Part 1. Why is baking soda so effective? Baking soda, also known as sodium bicarbonate, isn't a miracle drug. But when you understand how it works, you'll realize it's one of the simplest yet most powerful tools to help restore balance in an aging body. Here's why. Backhand index pointing right first. Baking soda is a strong alkaline substance. When taken internally, it neutralizes excess acid, a major cause behind many health issues in people over 60, from acid reflux and joint pain to chronic inflammation. As we age, our stomach tends to produce less acid and digestive enzymes, but ironically becomes more prone to acid imbalance, causing symptoms like heartburn, bloating, and indigestion. Baking soda gently helps rebalance the stomach environment. Backhand index pointing right second. Baking soda helps balance the body's overall pH. Our body works best when blood pH is stable, around 7.35 to 7.45. But stress, poor diet, and chronic conditions can acidify the blood, leading to persistent fatigue, unexplained inflammation, joint and muscle aches, lowered immunity. Baking soda supports pH balance, creating a better environment for your liver, kidneys, and immune system to function optimally. Backhand index pointing right third. Baking soda supports gentle detoxification at the cellular level. Studies show that when your internal environment becomes too acidic, cells struggle to flush out toxins. This leads to waste buildup and chronic fatigue, a common issue among older adults. In the right dose, baking soda can help dilute excess acid in the blood, easing the burden on your detox organs. Backhand index pointing right fourth. It has anti-inflammatory and mild antimicrobial effects. Baking soda doesn't just alkalize. It also gently reduces inflammation and supports bacterial balance, especially useful in conditions like urinary tract infections, arthritis, or mild skin inflammations. This makes it helpful in calming chronic, low-grade inflammation, which underlies many age-related diseases. Pushpin in summary. Baking soda isn't a cure-all, but it's a powerful ally that helps your body regain its natural balance, something aging bodies struggle with. A simple glass of baking soda water, used correctly, may ease digestion, soothe joint inflammation, support gentle detox, build a stronger foundation for whole body health. Direct Hit Part 2. How to prepare baking soda water the right way. A common mistake many people make is using the wrong dose, timing, or mixing method, which leads to poor results or even side effects. Remember, the difference between benefit and harm lies in how you use it. Test tube proper mixing formula. Small blue diamond ingredients. 1/4 teaspoon of pure baking soda, about 1 gram. Choose 100% sodium bicarbonate, food grade or pharmaceutical grade, with no additives. 1 glass of warm water, 200 to 250 milliliters. Not cold or too hot. Ideally 40 to 50 degrees Celsius, 104 to 122 degrees Fahrenheit, for better solubility and to be gentle on the stomach. Small blue diamond how to mix. Add 1/4 teaspoon of baking soda to the glass. Pour in warm water and stir until fully dissolved. Sip slowly, best on an empty or light stomach. Alarm clock, best time to drink. Pushpin choose timing based on your goal. Small blue diamond for digestion, acid reflux, or heartburn. Drink in the morning after waking or between meals on an empty stomach. Small blue diamond for pH balance and gentle detox. Drink 30 minutes before breakfast. Small blue diamond for mild constipation. Drink in the early morning, followed by a glass of plain water 15 minutes later to stimulate bowel movement. Warning: important precautions. Stop sign 1. Do not drink after a full meal. It can disrupt digestion or cause bloating. Stop sign 2. Do not exceed the recommended dose. Stick to once a day and avoid continuous use for more than 2 weeks without medical advice. Stop sign 3. Do not mix with vinegar, lemon juice, or honey unless you understand the biochemical effects. This can irritate the gut or cause rapid pH shifts. Stop sign 4. Consult a doctor first if you have specific health conditions. High blood pressure due to sodium content, kidney disease, edema or fluid retention, taking diuretics or heart medications. White heavy checkmark tips to boost effectiveness. Avoid eating for 15 to 20 minutes after drinking. Stay well hydrated throughout the day. Follow a low-acid diet. Focus on veggies, avoid sugar and fried foods. Direct hit quick recap for seniors. Small Blue Diamond formula. A quarter teaspoon baking soda plus 1 glass warm water. Small Blue Diamond best time. Morning on an empty stomach. Small Blue Diamond frequency. Once daily, no more than 2 weeks continuously. Small Blue Diamond safety. Consult your doctor if you have existing health issues. Direct hit part 3. 12 health issues that can improve with proper use of baking soda. You might be surprised to learn that just 1 glass of baking soda water per day, when used properly, can help ease up to 12 common health issues that older adults often face. Let's walk through each one, and you'll see why your body needs a gentle, alkalizing boost every morning. White heavy checkmark 1. Heartburn and acid reflux. Backhand index pointing right. Baking soda neutralizes excess hydrochloric acid in the stomach, the main culprit behind burning sensation, burping, and bloating after meals. Stopwatch relief can often be felt within just 5 to 10 minutes. White heavy checkmark 2. Bloating and indigestion. Backhand index pointing right. When stomach acid is imbalanced, food can ferment and produce gas, causing discomfort and bloating. Baking soda helps break down gas and supports gentler digestion. White heavy checkmark 3. Arthritis and chronic joint pain. Backhand index pointing right. A study from Augusta University, USA, found that baking soda can trigger the body's natural anti-inflammatory response, reducing pain and swelling, especially helpful for those with rheumatoid arthritis or long-term osteoarthritis. White heavy checkmark 4. Chronic fatigue. Backhand index pointing right. Always feeling tired without a clear cause? It may be due to acidified blood. Baking soda helps restore proper pH balance, boosts cellular energy, and helps you feel more awake in the morning. White heavy checkmark 5. Muscle soreness after activity. Backhand index pointing right. Lactic acid buildup in muscles causes stiffness and soreness after walking or physical activity. Drinking baking soda helps reduce this acid and speeds up muscle recovery. White heavy checkmark 6. Mild urinary tract infections, UTIs. Backhand index pointing right. Bacteria thrive in acidic environments. Baking soda alkalizes urine, making it harder for bacteria to multiply, easing burning or discomfort during urination. White heavy checkmark 7. Mild constipation. Backhand index pointing right. Some people report easier bowel movements after a few days of regular baking soda intake, thanks to its gentle detoxifying and digestive stimulating effects. White heavy checkmark 8. Sleep problems from stress or pH imbalance. Backhand index pointing right. Acidic blood overstimulates the nervous system, making it harder to relax or fall asleep. Baking soda supports a more balanced internal environment, promoting deeper sleep. White heavy checkmark 9. Bad breath and mild gum inflammation. Backhand index pointing right. Rinsing your mouth with diluted baking soda can remove odor-causing bacteria, soothe mild gum issues, and support oral health, especially in seniors with weaker teeth. White heavy checkmark 10. Small kidney stones or risk of stone formation. Backhand index pointing right. Acidic urine promotes stone formation. Baking soda raises urine pH, preventing the crystallization of oxalates and uric acid, 2 common causes of kidney stones. White heavy checkmark 11. Gout and high uric acid levels. Backhand index pointing right. One of baking soda's lesser-known benefits. It may gently lower uric acid levels in the blood, reducing the risk of gout flare-ups. White heavy checkmark 12. Mild fungal infections, skin or oral. Backhand index pointing right. Thanks to its antifungal properties, baking soda can be used topically or as a gentle mouth rinse to soothe issues like candidiasis, athlete's foot, or mild oral thrush. Pushpin important note. Baking soda is not a replacement for medication. It is a supportive wellness tool that helps create a healthier internal environment, allowing your body to self-heal more effectively. Just 1 warm glass each morning with a pinch of baking soda. You're giving your liver, kidneys, stomach, and immune system a chance to rest, reset, and perform better. No fancy products needed, just the right approach. Direct hit part 4. who should not use baking soda. Baking soda is a powerful ally, but like any tool, if used on the wrong person or at the wrong time, it can do more harm than good. So, please pay close attention to these 6 groups. If you belong to any of the following categories, do not self-medicate with baking soda orally, and always consult your doctor before using. People with high blood pressure, hypertension. Because baking soda contains sodium, it may worsen blood pressure if used long-term. Those with kidney disease or impaired kidney function. The kidneys may struggle to eliminate excess sodium or maintain proper pH balance. Individuals with edema or fluid retention. Sodium can cause the body to hold on to water, worsening swelling or puffiness. People taking diuretics or heart medications. These drugs may interact with sodium or disrupt your electrolyte balance. Patients with congestive heart failure. High sodium intake may place additional stress on the heart. Anyone on a strict low-sodium diet prescribed by a doctor. Even a small amount of baking soda might exceed the safe daily sodium limit. If you're unsure whether baking soda is safe for your specific condition, ask your healthcare provider before starting. Prohibited 1. People with high blood pressure or water retention. Backhand index pointing right. Baking soda contains sodium, the key component of table salt, NaCl. Even just 1/4 teaspoon per day, if used regularly, can increase blood pressure, cause fluid retention, add extra strain on the heart and kidneys. Pushpin. If you've been diagnosed with hypertension, heart failure, or often experience swelling in your legs or face, avoid using baking soda unless under medical supervision. Prohibited 2. People with kidney disease or impaired kidney function. Backhand index pointing right. When the kidneys are weak, they can't filter sodium properly. In these cases, baking soda can increase the risk of electrolyte imbalance, lead to metabolic alkalosis, worsen swelling and high blood pressure. Pushpin. People with kidney issues must carefully control all forms of sodium intake. Prohibited 3. People taking blood pressure, diuretic, or heart medications. Backhand index pointing right. Baking soda can silently interact with certain drugs like diuretics, furosemide, hydrochlorothiazide, can cause severe potassium loss. ACE inhibitors, beta blockers. pH changes may lead to irregular heartbeat. Antacids, calcium, aspirin may affect absorption rates abnormally. Pushpin. Always consult your doctor before combining baking soda with any of these medications. Prohibited 4. People with liver conditions, especially cirrhosis or severe fatty liver. Backhand index pointing right. In damaged livers, detoxification slows down. Over-alkalizing or sodium overload can disrupt electrolyte balance, increase risk of swelling, ascites, elevate liver enzymes further. Prohibited 5. People who eat a high-sodium diet. Backhand index pointing right. If your diet already includes processed foods, salty sauces, canned meats, or instant noodles, your sodium intake likely exceeds daily recommendations. Adding baking soda will overload your system with salt, increasing risks of hypertension and potassium imbalance, especially dangerous for seniors. Prohibited 6. People with very weak stomachs or on long-term acid-blocking medication. Backhand index pointing right. Long-term use of acid-reducing drugs, e.g. omeprazole, esomeprazole, can suppress the stomach's natural function, impair absorption of vitamins and minerals. Using baking soda in these cases may overly alkalize the stomach, leading to persistent bloating, anemia, or chronic diarrhea. Baking soda is not a miracle cure, but if you're the right candidate and you use it properly, it can help you achieve better balance, smoother digestion, and a more comfortable aging process. And most importantly, listen to your body. Every reaction is a whisper from within. Direct Hit Part 5. How to use baking soda safely, effectively, and long-term. You've learned the benefits. You know who should and shouldn't use it. Now comes the most important question. Light bulb. How can you use it safely and still get results over time? Here is a carefully adjusted routine for oral use of baking soda, specially designed for those over 60 whose digestive, circulatory, and metabolic systems may be slowing down. Pushpin. Step 1. Dosage. Always start low and go slow. First week. Backhand index pointing right. 1/8 teaspoon of baking soda, about 0.6 g, dissolved in 150 milliliters warm water. Backhand index pointing right. Drink 30 minutes after breakfast. Backhand index pointing right once a day. From second week onward, if no side effects. Backhand index pointing right increased to 1/4 teaspoon, about 1.2 g. Backhand index pointing right can split into 2 doses daily, 30 minutes after breakfast and dinner. Push bin never exceed 1/2 teaspoon per day unless directed by a healthcare provider. Push bin step 2. Best time to take. Avoid taking on an empty stomach. Taking baking soda on an empty stomach may cause discomfort or upset pH balance. Backhand index pointing right, always take it at least 30 minutes after meals to neutralize excess stomach acid effectively. Avoid over-alkalizing the stomach. Pushpin step 3. Take breaks between usage cycles. Exclamation mark, do not use it daily for long periods without rest. White heavy check mark recommended safe cycle. Use for 2 weeks, take a 1-week break. After 2 to 3 cycles, take at least a 1-month break to allow natural adjustment. This helps avoid dependency and reduces the risk of sodium buildup or over-alkalization. Pushpin step 4. Support with an alkalizing diet. Baking soda is only a catalyst. Long-term health depends on your overall diet. White heavy checkmark, eat plenty of green vegetables and low-sugar fruits. White heavy checkmark, drink enough warm water. White heavy checkmark, reduce salty foods, canned goods, and sodas. White heavy checkmark, limit red meat, fried, or oily foods. Pushpin step 5. Monitor your body closely. Warning: if you notice any of the following signs, stop using baking soda and consult a doctor. Persistent nausea or bloating. Swelling in hands, feet, or face. Sudden rise in blood pressure. Ongoing diarrhea or digestive issues. Ledger: keep a simple weekly journal to track changes. You'll be surprised how small daily habits can lead to real improvements. Baking soda isn't magic, but when used wisely, for the right people at the right time, it can be a quiet companion helping your body heal, little by little, each day. Aging doesn't have to mean fatigue, pain, and discomfort. Sometimes, real change begins with a warm glass of water, a pinch of baking soda, and the right knowledge. You may have lived more than half your life. Your body may not move like it once did. But remember, the body's ability to heal and renew has never disappeared. It simply needs to be reawakened. And sometimes, that awakening doesn't require expensive pills or modern technology. Just something as simple as baking soda, when used mindfully. Sparkle's baking soda is no substitute for a doctor, but it might just be the walking stick that helps you stay balanced on your journey to better health. Loudspeaker: if you found this video helpful, please share it with your loved ones. White heavy checkmark, hit like so YouTube knows this content is valuable. White heavy checkmark, share this video with your parents, grandparents, or anyone dealing with acid reflux, indigestion, joint pain, or poor sleep. White heavy checkmark, and if you want more natural, easy-to-follow health tips, subscribe to this channel today. Wrapped gift: each week, I'll bring you 1 to 2 simple, yet powerful health solutions to help you live lighter, healthier, the natural way. Thank you for staying till the very end. Caring for your health doesn't have to be complicated, just consistent and thoughtful. See you in the next video, with something small that might just change a life.